Okay, so this next part is going to be very basics of some craniosacral therapy. So if you like this, you want to learn more, you like these techniques, I would highly suggest you go to the Upledger Institute or upledger.com, and they'll have a list of workshops and classes you can take to learn more about it, to get more involved with it. Anybody can take it, you don't have to be a massage therapist. So give them a shout and definitely do more. I'm just going to be going over it basically, so I'm not saying this is picture perfect craniosacral therapy. This is just basics for this. It's like an introductory kind of thing. Yeah. So the first thing, let's say she just wanted a craniosacral time on that. Okay. So first thing you want to do is you're just going to lightly push down her shoulders. You're just going to decompress her neck. Again, everything is super light. Trying to get her relaxed. I want to get these tissues a little bit relaxed. She's probably tense from the whole day. And so you might go back to some of your other techniques, and you're just going to lightly kind of prepare the body for a session of this. So you're just kind of lightly digging in, just trying to cue her to take some deep breaths, just kind of get ready to relax. So from there, what we're going to do is we need to find the ridge of the occipital bone back here. So basically before you follow the muscles up to the skull, and then you're going to run into, it's going to flatten, it's going to go a little bit, and then you're going to feel it start to move up, and you'll literally feel like a ridge. So that's way I can explain it. Yeah. So that's what we're going to try to find.
And it's pointed. It doesn't have like a little point to it?
That's the notch. That would be the notch.
So is that too high?
Yes, a little bit too high. So we want to go just a little bit underneath that.
Okay.
That's what we're trying to do. Good questions. So here now, initially I learned to have your fingers like this underneath on that ridge. But what I found is that there's what's called a lamboid suture. It's right here. And if you get a finger close to here, you can actually give somebody a headache. So we don't want that. So since then I've learned that, instead of doing this, if you can see, you want to do your ring finger and pointer finger on somebody, okay? So you're trying to find that ridge, and then you're going to come up like this and hook into it to pick up the head. Okay, so that's what I'm doing underneath there. Okay, so let me just do that first. So I got to relax. So now, with my fingers, I'm going to where I find the back part of the head, find that ridge. So now, what I want is I'm hooking those fingers in. And she's going to slowly, the angle of it will not force her, but her head's going to fall back like that.
Yeah.
So my fingers are not pointing at the ceiling, basically. And you just kind of sit here and relax. Sometimes I might do it for like just 10 seconds or so. Just look at how much time you got.
Yeah.
But this is not the main technique. So you just kind of go to 10, maybe 30 seconds is what I'd suggest. And then you're going to go into the next technique. The next technique is we're going to decompress this bone here from the skull. Make sure axis. This thing doesn't move. Anyway, so what we're going to do is we're going to go from here, and then you're going to push, and then your pointer fingers are going to hook on to the bone here on each side. And you're not trying to force it. It's just literally, basically with the intent, when you feel resistance, you just stop.
Cool. So are your fingers in the same spot that they just were? And you're just reaching to grab another spot?
Yeah. Okay. I'll show you here if we can. Hold up. Come in here and push up. Okay, that's the first one. Second one, actually I do re-grip. Okay. Come back, get support, and I'll hook in, because now initially initially my intent was pushing the fingers towards the ceiling.
Mhm.
Now my intent is pushing my fingers towards me.
Okay.
Decompressing your skull there from our cervicals. And now my pointer fingers are just lightly hooking in and going towards the direction of her toes.
Okay.
But I'm using the weight of a nickel, basically, that you do with all the techniques. It's just very, very light. More like just the intent. Just decompressing. And you hold that for a little bit. Then I'm going to let go. My hands come together. You hold that. Basically, my hands are going, I'm going this way. But just, you almost can't even see it when I do it.
Yeah.
So go ahead. So I'm here. So you may not feel anything. So it's just kind of taking the tissue. The same resistance as if I were to put my hands here and I'm going to separate them. That's how far her tissue wants to go.
Okay.
So I'm not trying to, force it.
Yeah.
So I'm going here. In the next technique, I'm just going to have these fingers, I'm going to slowly allow them to move towards her skull. And once I touch her skull, now I'm just supporting her head, and this is called a dural tube pull. Where basically, in your spine, have that screws kind of like the, that yellow part in here is kind of like the dural tube.
Yeah.
That's going through there. So basically it can kind of get stuck to the walls, and that's what you kind of feel. So what I'm doing is I'm pulling, and you'll actually kind of feel where it may feel kind of stuck. You may feel like for example, her head, when you pick it up, it may feel like that. So you're like, I want this straight. So you want to pull, and you just kind of lightly move her in that direction. You may feel some restriction. You just kind of go up to it, kind of encourage her body to go where you want to straighten it out to. And she'll slowly start to bend with you. So you just kind of lightly pull. So you just kind of work with it. You feel like kind of loosening up a little bit?
Mm-hmm.
So you just kind of work with that. And then when you're done with that, again, there's time allotted. You can spend a lot of time just doing dural tube pull,
Mm-hmm.
depending on how the body's responding.